Hey everyone, my name is Claire and I'm a nurse practitioner. Today I wanted to talk a little bit about helping to relieve some stress and overwhelm that new nurse practitioners experience. I know as a new grad, I was very stressed in my first few weeks and months and even year into practice, but um, obviously, the more time that passed, the more experience I got, the more comfortable I felt. But definitely the discomfort I felt in the beginning was something that I wanted to relieve as soon as possible. So, in effort to help ease some stress for new grads, I wanted to share a tip on something that I think could be very helpful. So, as a nurse practitioner, our role primarily is diagnosing various conditions and prescribing medications. And I think with that understanding, new grads especially might feel that there is a requirement to prescribe medications for every new patient that you see. That a patient comes in, they're struggling with a condition, they want to feel better, and so you need to prescribe medications on that first visit. Now, that can be very stressful because when someone comes to you and they have an issue and you feel like you need to prescribe that, and you're new at that, that can feel very stressful. But I want you to know that that is not always the best course of action. In fact, it can be negligent at times if a person comes to you, if a patient comes and is not doing well, and your immediate reaction is prescribing a medication. The reason is that might not be the best course of action. Sometimes we need to gather more information because patients are very complex. Maybe they came from another provider and you want to gather records first to get a sense of the past medication history before you're going ahead and prescribing the medication. Or maybe you want to obtain lab work to see their liver functioning before you go ahead and prescribe a medication. Or you want to get other tests first. And so it's not always smartest or best to necessarily prescribe a medication just because you can. That can, in fact, as I said, be negligent or dangerous. And so know that a patient coming in maybe expecting a medication, that's not necessarily the best course of action, and that your role is to assess and figure out the steps to take next, some of which may require prescribing, but other times you want to gather more information first, that you are not mandated to prescribe just because a patient comes in. You might need to take time and as I said, look over past records. You can talk to your collaborating provider if you live in a state that requires one, just to gather more insight, because the worst thing you can do is to prescribe something and it causes patient harm. But I say all this to say that there needs to be kind of less pressure when we're starting, that we want to do our due diligence, making sure that we are prescribing safely and following best practices, and that doesn't always require prescribing medications. So I hope this helps ease a little bit of stress, and know that you are going to get better, and that your skills and competence and confidence will grow throughout your time, and that the hardest part really is the beginning, but as you go, you are going to be a wonderful provider. I think that's it. I will see you next time.